My name is Hong. I'm doing the HEENT. So as I'm looking at the general appearance of your head, it's normal cephalic, it's atraumatic. As I actually palpate the hair, it's soft and it's evenly distributed. Your temporal arteries, I'm going to go ahead and palpate. It's 2+ bilaterally. I'm going to check your TMJ this time. I'm going to go ahead and apply some pressure here. Go ahead and open up your mouth and close, open again and close. So it's smooth without any clicks. Range of motion, I'm going to go ahead and ask for you to look up and look down, put your chin to your chest, and then turn to your right, and then turn to your left. And then after, if you could put your right ear towards your right shoulder and left ear towards your left shoulder. So the range of motion, is, you have a full range of motion. The thyroid, I'm going to go ahead and palpate your thyroid. Okay, so there's no nodules, no thyromegaly noted. I'm going to check your trapezius strength, so I'm going to apply pressure here. If you could go ahead and lift up, okay. And then I'm going to check your sternocleidomastoid strength. I'm going to apply pressure to your right, and then I'm going to do it to your left and resist. And there is, it's fully intact, and the strength, and it's equal bilaterally. The next thing I'm going to do is I'm going to check your carotid, or I'm sorry, before I check your carotid artery, I'm going to check your sinuses. I'm going to go ahead and palpate. Do let me know if you feel any pressure or any tenderness there. None? Okay, how about down here? Okay, so no tenderness noted. Now I'm going to check your carotid artery. I'm going to go ahead and palpate one side. Okay, and then I'm going to palpate the other. Okay, so it's 2+ bilaterally. And I'm going to check for any bruits. So I'm going to go ahead and listen with my stethoscope. Okay, so no bruits noted. Your JVD this time, I'm going to go ahead and ask for you to lay down. And then I'm going to turn on the light. And then I'm going to check for your JVD. So go ahead and face towards the left. Okay, so no JVD noted. Okay, this time, go ahead and stand up. I'm going to check your eyes. So I'm going to go ahead and pull this light. General appearance of your eyes, it's equal. There's no deformities, no discharges noted, and it's symmetrical. I'm going to check your eyelids. So I'm going to go ahead and pull down your eyes. Sorry, let me just here. I'm going to pull down your eyelids. I'm going to ask you to go ahead and look up, okay, and look down. Great. So your eyelids or your sclera is white, and the conjunctive is it's clear. There's no discharge. It's intact and pink. Cornea is looking on the side. Look straight ahead. Is clear. Look straight. Thank you. Now I'm just going to go ahead and take a look into your eyes again. I'm going to check. Okay, so there's a red reflex is present. Look straight ahead. Okay, there's no hemorrhages or any exudates noted. Oops, sorry. Check your pupils. Look straight at me. Okay, so the pupils are equal reactive to light, and this time I'm going to check for accommodation. So go ahead and look at my nose, and then look at the back to the wall, and look back at my nose real quick, and it's equal to accommodation. Check your visual acuities. Simon, if you can, go ahead and hold on to that and read to me the lowest line that you could read.
4,28739.
Okay, so it's equal bilaterally. I'm going to do your cover test this time. Okay, and just look straight ahead at me. As I'm covering one eye. Okay, so there's no drift. It's equal bilaterally. And now I'm going to check your gazes and do your confrontation test. So what I'm going to do is have you look straight up at the bridge of my nose, or I'm sorry, follow my finger with just your eyes. Okay. Great. And then this time I'm going to ask for you to cover your right eye, cover my left, and then let me know when you see my fingers come into your field of vision.
No.
Okay.
No.
Okay.
No.
Okay, and the other eye?
No.
so your extraocular eye movements are intact, and they're equal bilaterally with no drift. I'm gonna check this time. I'm gonna get the otoscope and check your ears. Okay, just the general appearance of your ears. It looks symmetrical. I'm gonna go ahead and palpate your ears. No nodules present. I'm gonna go ahead and press down on your tragus. Any pain notice here? How about here?
No.
Okay, and then I'm gonna press your on the back of your mastoid. Any pain or tenderness?
No.
Okay, and how about here?
No.
Okay, so patient denies any tenderness in the mastoid or the tragus, and there's no nodules noted on general examination. I'm just gonna take a look into your ears. Okay, so I'm gonna pull this back. Your external canal is actually clear. There's it's not red or swelling, and then your tympanic membrane is actually clear. It's actually creamy orange, and no signs of any trauma or any trauma. Sorry. I'm gonna now do this whisper test, and I'm gonna go ahead and whisper into your ears if you can with your right hand. Press onto the tragus, and then I'm gonna whisper 3 letters to you.
B. C. D.
Great. Okay, so the whisper test, the patient is normal, and then this time I'm going to take a look into your nose. General appearance, you look like it's symmetrical. There's no deformities noted, no postnasal drip. As I look into your, before I actually look into your nares, I'm going to go ahead and have you press onto one nair and take a deep breath in, and then the other one. Okay, so the nose is patent. We'll now look into your nares. Okay, and it terminates is clear. It's not red or swelling. There is no, and the septum is midline, and no discharge noted. The next thing I'm going to do is the mouth. General appearance of the mouth. It's there's no trauma. It's pink and moist. If you could actually pull down your lips and then lift up your lips. Yeah. So the lips are pink and moist. Can you smile for me? Okay. Great. So the gums and the dentures it's good dentation, and it's intact, and the gums are moist without any swelling or any bleeding noted. I'm gonna go ahead and grab the otoscope. Okay, so this time I'm gonna ask for you to go ahead and open up your mouth, and then I'm just gonna go ahead and take a look in. Okay, so the hard and soft palate, it's soft. It's without any redness or swelling. Go ahead and stick out your tongue. Go ah. Okay, and the uvula is midline, and it does rise. The tonsils are 2+, and the posterior pharyngeal, the postpharyngeal wall is, without any erythema or postnasal drip. That's it.
Yeah.
I think that's it.